Hi, you guys. Welcome back for our daily practice questions. It is day 33, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners with exam success. Now, my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 60-year-old male with a history of hypertension and gout presents for follow up. His blood pressure is 150 over 95. He reports frequent gout flare ups and elevated uric acid levels. Given his history, which of the following medications is contraindicated for this patient? Is it a thiazide diuretic? Is it B, an ACE inhibitor? Is it C, a calcium channel blocker? Or is it D, a beta blocker? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the stem of the question states, given his history, which of the following medications is contraindicated for this patient? So that means we just got to take a step back and look at everything that is provided to us. So we have a 60-year-old male. He has a history of hypertension and gout. His blood pressure is elevated. So we're needing to treat that, right? And he has frequent gout flare-ups and elevated uric acid levels. Well, first things first, we should know, and you should know that A is your best answer because we don't give thiazide diuretics to patients with gout. Remembering that thiazides can increase the uric acid levels. So, especially in those patients, because, again, in a patient by patient basis, if the benefit outweighs the risk, we will. But guidelines state not to give it because of the impact thiazides have on those uric acid levels. So someone who presents and they're telling you not only do they have a history of gout, but they have frequent flare-ups and elevated uric acid levels, we don't want to contribute to that. So A is your best answer. Thiazide diuretics are the ones that are contraindicated for this particular patient. All right, question number 2. A 68-year-old female with stage 3 chronic kidney disease and hypertension presents for evaluation. Her blood pressure is 160 over 100. Which of the following is the most appropriate next step in managing her hypertension? Is it A, to initiate a thiazide diuretic, B, start an ACE inhibitor or an ARB, C, prescribe a calcium channel blocker, or D, a beta blocker? Tell me what y'all think in the comments, y'all. All right, so stem of the question here, which of the following is the most appropriate next step in managing her hypertension? All right, so again, managing her hypertension lets us know that this is a treatment style question. I typically say, hey, if they're asking for a treatment, look to see if they have provided you with a diagnosis. But the stem tells you all of those things. We're looking for a treatment for hypertension, right? So let's see what other factors and things are included that we need to work through. So we have a 68-year-old female. She has a history of stage 3 chronic kidney disease and hypertension. Blood pressure is significantly elevated today. And so we do need to provide management. But remember, whenever we need to provide renal protection, we want to go with B, either an ACE or ARB, right? So you would go directly there. Remember your first line therapy. I tell you, think of those starting 4. You have your thiazides, your ACEs, your ARBs, and your calcium channel blockers, with thiazides being the top of those first line therapy, unless there's reason that you should not give it, like question number 1, like they have gout. Or in this scenario where there's clearly a need for renal protection, they have stage 3 chronic kidney disease, then you would move with an ACE or an ARB first, okay? So make sure you know all these steps so that however the scenario is presented to you, you're able to adjust to answer these questions, but also in practice. All right, lastly, question number 3. A 54-year-old male with a history of hypertension presents with complaints of muscle weakness, fatigue, and frequent urination. His serum potassium level is found to be 3.0. Given his potassium levels, which antihypertensive class should be avoided? Is it A, a thiazide? Is it B, an ARB, C, calcium channel blocker, or D, beta blocker? Tell me what you got in the comments, y'all. All right, so given his potassium levels, which antihypertensive class should be avoided? So since we're focusing on his potassium levels, his potassium is 3 milliequivalents, right? And we know that's on the lower side. So again, you want to avoid those thiazide diuretics because thiazides can actually decrease potassium levels. So we try to avoid thiazides in patients with hypokalemia, okay? All right, you guys, make sure y'all know these contraindications too. I'll continue to keep these in the mix of this so that you're able to tie it together as you're reviewing particular areas of particular systems. So just like this, as we're going over hypertension, I'll throw in some of these things as far as a little bit deeper dive into the medicines so that y'all make sure that y'all are retaining and applying effectively and studying effectively, because sometimes you'll go through the path of, okay, you should give a thiazide, but then you don't know when you shouldn't give it. And then that's what's going to trip you up on boards, right? So hopefully you found this helpful. As always, y'all, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1, at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. But if you're looking to book any of my one-on-one sessions or custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type, okay? But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.